all blessed, and it encourages us. Kindly be the torch bearers in these types of diseases by making awareness to the people that they are not contagious. We should love these people, we should mix with these people. By any means, we will not get these diseases by touching them, by handshaking them, or by being with them. So this is the message today, and try to be affectionate to them as much as possible. Thank you very much.
Respected Executive Director, sir, please share your views and strengthen our patients.
इज्जतमान चेयरमैन साहब, प्रिंसिपल साहब, एमएस, जीएमएस और हमारे हॉस्पिटल मैनेजर विश्वास साहब, बाकी साथियों लोग भी सामने बैठे हुए हैं, सबके शुक्रगुजार हैं कि सब लोग यहाँ पे मौजूद हैं। और ख़ास तौर से इस डिपार्टमेंट के सारे लोगों के, पीजीटीज के, टीचर्स के, आप लोगों ने जो अवेयरनेस प्रोग्राम यहाँ पे रखा, काफ़ी यहाँ पे कुछ शेड्यूलिंग ऐसी है कि जिसकी वजह से थोड़ी कठिनाई आप लोगों को हुई।
Deputy Superintendent sir and all respected professors, colleagues and dear students, as we gather to observe World Vitiligo Day, I would like to take a moment to acknowledge the significance of this occasion. Today, we come together to raise awareness about vitiligo, a condition that affects millions worldwide. The World Vitiligo Day is celebrated on June 25th to pay tribute the passing of musical artist Michael Jackson, who lived with vitiligo, a skin condition causing pigment loss, and to raise awareness about this condition. The World Vitiligo Day is celebrated to raise awareness about vitiligo, a skin condition characterized by loss of skin pigmentation. The day aims to reduce stigma, promote acceptance, and provide support for those affected by vitiligo. It also encourages research and improve healthcare services for individuals with this condition. The theme for 2025 World Vitiligo Day is Innovation for Every Skin Powered by Artificial Intelligence. This theme emphasizes the role of artificial intelligence in transforming vitiligo diagnosis, treatment, and patient care. The focus is on leveraging artificial intelligence to improve access to accurate information, personalized treatments, and relapse prevention for the vitiligo community. It also encourages research and improve healthcare services for individuals with this condition. Now I request Dr. Asna to present a small ceremony on vitiligo.
अब कोई भी चीज को, इस इन्फ्लेमेशन को हमने दो पार्ट में डिवाइड किया है, अक्यूट इन्फ्लेमेशन एंड क्रॉनिक इन्फ्लेमेशन। acute
माइक ला दे।
I'd like to invite you to please come here and share your thoughts related to vitiligo and encourage our patients.
हमारे डेमेटोलॉजी डिपार्टमेंट के शिक्षक, पीजी छात्र, पीजी छात्र और विभिन्न विभाग के हमारे डॉक्टर और पेशेंटगण, ये अवेयरनेस प्रोग्राम बहुत ही अच्छा प्रोग्राम है। ये आप लोगों ने इसको चलाया है, जिससे हमारे पेशेंट को बहुत फायदा होगा। हम उम्मीद करते हैं कि आप लोग ऐसे ही हमेशा अवेयरनेस प्रोग्राम चलाते रहेंगे ताकि लोगों को फायदा मिलता रहेगा। धन्यवाद।
Respected principal sir, please you also share your views and strengthen our patients.
Honorable Chairman sir, Honorable Executive Director, my dear friend and Honorable Professor Giri Saab, and senior faculty present in the gathering, faculty of dermatology and PG students and patients. The public awareness of any kind in an institution, in a medical college, makes it a big institution. CMEs and awarenesses from time to time differentiate small nursing homes from big medical colleges. And it's a pleasure, I am also part of this academic exercise. Already we have heard Dr. Amit briefing about importance of particular day. I am highly thankful to our Honorable Chairman sir to grace the occasion. We are all blessed and it encourages us. Kindly be the torch bearers in these types of diseases by making awareness to the people that they are not contagious. We should love these people, we should mix with these people. By any means, we will not get these diseases by touching them, by handshaking them, or by being with them. So this is the message today, and try to be affectionate to them as much as possible. Thank you very much.
Respected Executive Director sir, please share your views and strengthen our patients.
इज्जतमान चेयरमैन साहब, प्रिंसिपल साहब, एमएस, जीएमएस और हमारे हॉस्पिटल मैनेजर, डॉक्टर साहब, बाकी साथियों लोग भी सामने बैठे हुए हैं, सबके शुक्रगुजार हैं कि सब लोग यहाँ पे मौजूद हैं। और ख़ास तौर से इस डिपार्टमेंट के सारे लोगों के, पीजीटीज के, टीचर्स के, आप लोगों ने जो अवेयरनेस प्रोग्राम यहाँ पे रखा, काफ़ी यहाँ पे कुछ शेड्यूलिंग ऐसी है कि जिसकी वजह से थोड़ी कठिनाई आप लोगों को हुई। चलिए, बहुत अच्छा आप लोगों ने काम किया है और मैं उम्मीद करता हूँ कि ऐसे ही आप लोग करते रहेंगे। बाकी चीज़ें हमारे प्रिंसिपल साहब ने बता दिया। चलिए, शुक्रिया।
Thank you so much. Now I would like to invite Dr. Tuhina Surbi and Dr. Shashank sir to say myths and facts related to vitiligo. Honorable Hospital Administrator sir.
Good morning everyone. Warm welcome to all. I, Ashnu Zamil, going to speak on vitiligo. First of all, I'll talk about the etiopathogenesis of vitiligo. There is no single cause, there is multifactorial condition which leads to this condition: genetic, autoimmune, biochemical, neural and environmental factors. Genetic factors, the family history, approx 20 to 30% of the cases, gene involves are NLRP1. These all genes affects the immune regulation and melanocytes function and autoimmune. Second one is the autoimmune theory, which is most accepted, and it's immune-mediated melanocyte destruction. The anti-melanocyte antibodies destructs the melanocytes and regulatory T cell dysfunction. Oxidative stress, melanocytes are sensitive to oxidative damage, reactive oxygen species and like hydrogen peroxide that damage the melanocytes. Reactive oxygen species triggers the immune response and causes apoptosis. Neural theory explains that abnormal neural chemical releases like norepinephrine from nerves that leads to the damage to melanocytes. This explains some of the vitiligo like segmental, which is along the dermatomes. Melanocyte self-destruction theory, this explains the melanin during the synthesis releases some of the toxins like dopa-quinones, and this self-generated toxins causes melanocyte apoptosis. Environmental factors that triggers the vitiligo in genetically predisposed individuals, that includes trauma, sunburn, chemical exposures, emotional stress. This is the combined etiopathogenesis of a model of this genetic, environmental, oxidative, autoimmune and melanocyte, which I already discussed. Overview of vitiligo. In this, I'll tell that it's not a contagious and not life-threatening. It's curable. Prevalence is approx 0.522% worldwide. Commonly it starts before the age of 30 years, but it can also occur in any age group. Classification of vitiligo, it mainly classified in two types, non-segmental and segmental. Unclassified, which is not fit in either both of them. First, in this image, I can see that all of you can see this, the image of a vitiligo, which is a non-segmental vitiligo, and bilateral symmetrical distribution often associated with autoimmune disorders. Onsets like in the fingers, faces, orifices, oral and preorbital regions. Non-segmental subtypes. In image A, segmental universalis, which affects almost all the parts of the body. Mucosal, affecting the preoral region involving the oral, lips and mucosa. Punctate, these are small dots which are present in image C, present as like clustered or scattered. Follicular vitiligo, in image D, you can see the image of the follicular vitiligo, it arises around the hair follicles. And in the image E, acrofacial, which affects the hands, oral and preorbital regions. Segmental vitiligo, this is the image showing unilateral distribution along the dermatome affecting the one side of the body. It is rapid in onset, it is most common in childhood. Unclassified, which is like focal vitiligo, the child is showing the focal vitiligo isolated macule, and mucosal, like some in the single mucosal site involves, it is indeterminate. Morphological variants of non-segmental vitiligo are trichrome. In image, you can first trichrome, which is like white, hypopigmented and normal background, with quadrichrome affecting the prefollicular hyperpigmentation. Blue vitiligo, that is the bluish lesion around the vitiligo. Inflammatory with the inflammatory raised borders with the reddish margins. This is the summary which I already discussed, the vitiligo. Now I would like to call Amreen Heather to continue the seminar.
Good morning everyone. So I'll be discussing the part of investigations and treatment of vitiligo. Starting with clinical examination. It is the first and most essential step in diagnosis for vitiligo. It is used to assess types of vitiligo, whether it is segmental, non-segmental, extent of vitiligo, and Koebner's phenomena. It also helps to rule out mimicking disorders like P. alba, leprosy, hypomelanosis of Ito, and idiopathic guttate hypomelanosis. Second is wood lamp examination. We use UV light to detect depigmented areas. Lesions appear bright blue-white under lamp, useful in early or fair skin cases. Coming to skin biopsy, that is histopathology, we see loss of melanocytes, normal epidermis, early inflammatory infiltrate. It helps to rule out other hypopigmentary disorders. Blood investigation. To detect associated autoimmune or systemic diseases, thyroid profile, because vitiligo has common association with autoimmune thyroiditis, fasting blood sugar or HbA1c, because vitiligo has association with type 1 diabetes mellitus, vitamin B12 and folate to screen for autoimmune gastritis, ANA and CBC. Now we also do autoimmune panel and imaging, autoimmune antibody panel for APS or systemic symptoms, imaging like ultrasound or MRI if symptoms suggest thyroiditis or neural involvement, used selectively based on clinical indications. We also do dermatoscopy, in which we see perifollicular hyperpigmentation. We also look for any anti-melanocyte antibody. This is a small summary showing investigations and purpose. Now coming to the treatment of vitiligo. General measures for treatment of vitiligo. First of all, sun protection is very important as patients' skin lack melanin and it can lead to carcinoma. Cosmetic camouflage for skin colored makeup, example derma blend. Counseling and psychological support for vitiligo patients. We can also topical therapy for localized vitiligo. We can give topical corticosteroids, calcineurin inhibitors like tacrolimus or pimecrolimus, vitamin D analogs like calcipotriol, and topical JAK-STAT inhibitors like ruloxitinib. Systemic therapy is used for generalized or progressive vitiligo. We can give oral corticosteroid in mini pulse as a weekend therapy. We can also start methotrexate as a thioprine, oral JAK-STAT inhibitors like tofacitinib, ruloxitinib, and antioxidants like ginkgo biloba. Vitiligo can also be treated by phototherapy. We have a poor chamber in our OPD and we are treating patients using phototherapy with good results. Narrow band UVB, it is given 2 to 3 times per week. It is effective for face and trunk. PUA, oral or topical Soralin with UVA, and excimer laser 308 nanometer. It is a localized therapy 1 to 2 times per week. Coming to surgical treatments. Surgical treatments is given in stable vitiligo. Punch grafting is done. Small graft from pigmented areas is taken. Suction blister grafting, split thickness grafting, cell-based therapy, and tattooing. There are various newer and experimental therapies associated with vitiligo treatment. Some of the biologics are tofacitinib, ruloxitinib, baricitinib, ustekinumab, dupilumab, etanercept, adalimumab, infliximab. Here are pictures of our OPD patients. We have treated vitiligo in these patients. Here are pre and post treatment pictures. Here is a small summary of vitiligo treatment options. To all of you who are present here today, thank you for taking out time from your busy schedule to be a part of this program. Your presence today strengthens our mission, encourages us, and gives strength to our patients. Let us together create a world where hope, imaginations, and acceptance rule. strengthen our patients.
Honorable Chairman sir, Honorable Executive sir, Honorable Principal sir, and respected colleagues, friends, all the faculties available here, and PG students. Vitiligo is an important disease, we know, and awareness is again better. We have got food safety chamber in our department of dermatology. This is very good. We should utilize it full to the capacity of patients. Thank you.
Honorable DMS sir, please you also strengthen our patient by your precious words.
Honorable Chairman Sahab, Director Sahab, Principal Sir, and respected all senior and faculty and our PG students. This awareness program is very important for our society. Most of people think it is a infection disease, but it is not. This awareness program, I think, Skin Department thanks for this special thanks.
आज हमारे प्रोग्राम में हिस्सा लिए हैं। आज सबका यहाँ होना हमारे पेशेंट को इंकरेजमेंट और हमारे पेशेंट को स्ट्रेंथ दे रहा है और आगे भी देता रहेगा। चलिए मिलकर एक ऐसी दुनिया की कल्पना करें और उम्मीद करें जहाँ रंग इंसानियत मायने रखता है। अब मैं डॉक्टर लीला और डॉक्टर शशांक को बुलाना चाहूंगी वीडियो से रिलेटेड और जानकारी को बताने के लिए।
नमस्ते, जो लोग भी यहाँ मौजूद हैं, आज मैं आप सबको कुछ सफेद दाग से रिलेटेड मिथक एवं तथ्य बताऊंगी। मिथक: सफेद दाग एक झूठ की बीमारी है और यह निजी वस्तुओं को साझा करने या भोजन को एक साथ खाने से फैलती है। तथ्य: सफेद दाग एक संक्रामक बीमारी नहीं है और यह व्यक्तिगत सामग्री साझा करने या साथ में खाना खाने से नहीं फैलती है।
Vitiligo is a contagious disease and is spread by sharing personal items or eating food together. Fact: Vitiligo is not a contagious disease and is not spread by sharing personal belongings or eating food together or by touching or talking with each other.
मिथक: सफेद दाग वंशानुगत है और भविष्य की पीढ़ी में फैलता है। तथ्य: सफेद दाग केवल कम संख्यात्मक जनसंख्या में ही होती है, आनुवांशिक होता है और अधिकांशतः मामलों में पारिवारिक इतिहास नहीं होता है।
Vitiligo is hereditary and is passed on to future generations. Fact: Vitiligo is hereditary only in small number of population.
मिथक: सफेद दाग कुछ रोग के समान है। तथ्य: सफेद दाग एक संक्रमित बीमारी नहीं है, इसका कुछ रोग से कोई संबंध नहीं होता है।
Vitiligo is similar to leprosy. Leprosy is caused by bacterial tuberculosis. Fact: Vitiligo is not a contagious disease and is not related to leprosy. It is an autoimmune disorder.
मिथक: सफेद दाग कड़वे खाद्य पदार्थों एवं मांसाहारी आहार से बढ़ जाता है। तथ्य:
by eating 300 ml one third, then we tell them that this disease is not related to any type of food eating.
सफेद दाग इलाज योग्य नहीं है और इसका कोई प्रभावी उपचार नहीं है। तथ्य सफेद दाग का उपचार डर्मेटोलॉजिस्ट द्वारा चिकित्सक एवं सर्जिकल तरीकों से संभव है। इसके इलाज के लिए कोई सुरक्षित और प्रभावशाली विकल्प उपलब्ध है।
Vitiligo is not treatable. In fact, vitiligo is treated medically or surgically by a dermatologist. There are many different effective options available for the post-management. It is 100% curable and manageable by both treatment and dermatology. Thank you.
इसलिए अब हमें ये जानकारी मिली है कि सफेद दाग कोई शर्म की बात नहीं है। बहुत से लोग आत्मविश्वास के साथ जीते हैं। जागरूकता, समर्थन और उपचार से जीवन बदला जा सकता है। धन्यवाद।
हो गया पेशेंट से पूछ लो।